Hello and welcome to Points North here on Interlochen Public Radio. I'm Linda Steffen, sitting in today for Peter Payette. This week, Leadington's hospital leaders announced they'll look for a larger player to partner with. There's been a lot of that in recent years in Petoskey, Sheboygan, and there were even talks a few years ago at Munson Healthcare in Traverse City. Hospital leaders around the area say in healthcare the future is just plain uncertain. The fiscal health of northern Michigan hospitals, the fate of Medicare, healthcare for seniors. If you look at the commercials flooding the airwaves this political season, the two major party candidates in the tight race for Michigan's 1st congressional district expect healthcare to weigh heavy on northern Michigan voters' minds as they head to the polls.
Well, I look at my parents, and having Medicare gives them the peace of mind and the security to know they're going to be okay. And they'll be able to live their golden years with that security and with that dignity. If people really knew what Dan Benishek was for, I don't think they'd be for Dan Benishek.
My dad was in his 70s, and they brought him to the emergency department. There was no way he would have lived had Dr. Benishek not been here.
He is working hard to make sure seniors get the health care that they need.
Dr. Benishek saved my father's life.
I'm proud to say that I know Dr. Benishek.
But mantras from the campaign advertisements do little to help us to understand the complexity of the healthcare debates, or the very different solutions advocated by the two major candidates in this district. So I recently sat down with Republican Congressman Dan Benishek and his Democratic opponent, former State Representative Gary McDowell, to try to get a better sense of the problems and the solutions each sees. We start the discussion with Congressman Benishek.
Oh, call me Dan.
Thank you very much.
Thanks for having me, Linda.
Can we back up a little bit and talk about what needs reform and why?
The problem is the Medicare Trust Fund will be out of money. Some people debate how long, from 4 years to 10 years. Basically, there's 10,000 people a day joining Medicare, and every day there's fewer people paying in. So, we want to fix it so that it is there for the future. Our solution, really, let me put it this way, is a bipartisan plan that keeps Medicare the same for people who are 55 years of age or older, and for those 54 years of age or less, allows you the option of either staying on traditional Medicare or opting for private insurance, which Medicare would pay for the premium. And the private insurance, you'd have a choice of different plans that may suit you better than traditional Medicare. So, I want to keep health care in control of the patient, the doctor, and the family, okay? I think it's bad when bureaucrats in Washington are going to be able to dictate, your health care. The unfortunate part of it is that the president's health care plan takes $700 billion out of Medicare to pay for his plan, and also imposes this independent payment advisory board, a group of 15 bureaucrats in Washington that are going to determine how to cut spending in Medicare when the trust fund, it becomes depleted. And there's no appeal from that. There's no, getting around it. There's a minority of medical practitioners on that. And, I'm concerned that people who are uninvolved with the patient are going to be making decisions with patients that they don't understand.
I'm interested in the cost containment aspect of it. If you look at the Affordable Care Act, and if you look at the plan that the Republicans are proposing,
right.
One would rely heavily on cutting reimbursements to doctors and hospitals and other providers. The Affordable Care Act. The Republican plan is more relying on business competition. Can you explain how that would control costs and why that's the option to go with?
Competition in any business will lower costs, and people, 30 or 40 different companies offering competing plans are going to be offering price discounts in order to save money. Medicare pays really oddly, okay? And, for example, if I cut a mole off in my office, okay, and I charge you $100 to cut the mole off, Medicare won't pay me the $40 that I would charge for the kit and the suture, okay? But they will pay the $2,000 to the hospital if I do the procedure in the hospital in the minor procedure room. They will pay the hospital $2,000 You know, I'm going, well, what? How does that make any sense? Why would I want to eat the $40? I can just do the procedure in the hospital, save myself $40, but cost Medicare $2,000. That kind of stuff happens every day. Those are the things that people don't understand about how Medicare is. And, you know, my familiarity with it, you know, makes me aware of that. You know, if a private plan will pay me the $40, that'll save $2,000 lots of times every day. And the other thing about this, Mr. Obama's plan is, as you said it correctly, it cuts payments to providers, hospitals, home health care, nursing homes. You know, our local hospitals operate on a razor-thin profit margin. And Medicare is a significant portion of their balance of payments. Okay, they have a provider mix, of which Medicare is one of them. Well, believe me, as you saw with the Sheboygan Hospital, there can be problems dealing with Medicare. Okay, and if they cut, you know, we're going to have difficulty with access. How are these hospitals going to stay open if Medicare pays them less? Okay, no, I understand how the hospitals need to be efficient. And frankly, for the last 30 years, Medicare has been cranking down the payments, trying to control costs. But believe me, I've talked to, you know, I've been on the board of the hospital at Dickinson County. I've talked to hospital administrators, physicians all across the district, and they are worried about the viability of the hospital. They're worried about the services that they can provide because they can't afford them anymore. Decreasing reimbursement makes it tough. And, you know, I'm really concerned that the president promises that you'll have health care, but you may not have your local hospital. You may have to drive a long way to find a hospital that's open. And, you know, I think it's a bad way to deliver health care in this country.
And I want to get back to that because we've definitely seen those concerns with hospitals throughout the district. But getting back to the question of competition versus the Obama plan, why do you feel that competition would be the right way to drive down costs as opposed to this board of people that make these decisions?
Well, I mean, I don't see that how the government dictating how things work cuts costs. The laws of each state and federal law, too, limits the amount of competition there can be in the health care insurance for not so much Medicare, but just health care in general. I mean, in the state of Michigan, there's only 3 or 4 health care insurance providers in the state. That limits competition. Why isn't it open like car insurance? Another thing that we like to look at is with the health savings accounts. You know, if your employer provided you with a health savings account instead of an insurance policy, you could pick the insurance policy yourself. And if we had more choice, you could pick an insurance policy that fit your family. If you want a high deductible, high coverage, you want dental insurance, I mean, you wouldn't have to pick a policy that your employer picked for you. So what's wrong with having more choice? The other thing that people don't talk about much as far as healthcare reform is tort reform. You know, I think that the malpractice system that we have in this country is really not a very good way to reimburse injured people in the first place. Okay, if you're injured by malpractice, it takes you 5 or 6 years in court. 60% of the money might go to your attorney and costs. How is that justice for an injured person? Why isn't there some sort of a, you know, administrative law system where, you know, a panel determines that indeed there has been an injury and somebody gets reimbursed without having to go through that whole process of court?
One of the fears with the Republican plan and with the idea of putting in competition is that ultimately costs continue to rise as we see in the healthcare sector, and that seniors end up shouldering a larger and larger burden.
Well, right. I mean, but the plan does take into account the fact that there may be inflation and that there need to be adjustment in the premiums, that the premiums will continue to go up and that they will be provided for, and that people who are better off would probably end up paying more. Those are provisions of our plan. Frankly, I think that you're not going to be able to control costs by the government dictating it. You know, the market is usually the best way to determine what the true cost of something is. Let me give you a good example, I think, of that. When when LASIK surgery first came out, I mean, it was like $3,000 an eye to get that done. And now you see ads in the paper where it's like $600 an eye because physicians were out there competing for people's business. You know, it wasn't covered by your insurance. People have to pay that money out of their pocket. And there's an example right there of a medical cost going down because of competition. I'm not saying that we should, you know, introduce a massive overhaul all right away, but let's have this conversation with the American people. Do a pilot program in one state. Let's have some, you know, innovative ideas that bring the market forces into play.
There's also always sort of a rub, I think, between people and their insurance companies, between doctors and insurance companies. I'm sure in your practice that you've experienced this. So are you comfortable with the idea of, rather than having government step in and